Health professionals at Magab Health Center, Housing District, Eastern Tigrai have been unable to provide adequate service for the past 3 years due to the war and siege-induced lack of medication. Gittet Hailu, Abrahat Hagos, and Mabrihit Addisalam are among those who are expecting to get medical service. They came from Magab and Debrahiwat vicinities in housing, but they say they're unable to get the service they were looking for here due to lack of medication and medical equipment.
When someone comes here to get medical service, there is lack of medication and medical equipment. We are desperate here.
The doctors here are good and very helpful, but we couldn't get adequate service because there is nowhere to sleep for the patients, and there's fluctuation in electricity and running water. The only medications you get here are medications for diarrhea and other relatively less severe illnesses, but there are no medication to treat severe and chronic illnesses, and the doctors only refer you to other hospitals.
The director of Magab Health Center, Tasfu Gabra, notes the center lost many chronic disease patients due to the war and siege-induced lack of medication, and he adds this is still ongoing as situation continues to be dire despite the signing of a peace deal. He states that the hospital is unable to treat patients and is referring patients to other health centers in other areas, and also adds that they're witnessing an increase in cases such as malaria, trachoma, and diarrhea.
chronic disease DM, hypertension.
We lost more than 20 among 250 chronic disease patients of hypertension, diabetes, and epilepsy due to the war-induced lack of medication. We used to refer these patients to several health centers and hospitals in other districts, including Ida Refer Hospital in Magala. In spite of this, we lost many of them. Even now, the lack of medication is ongoing. We are still referring patients to other hospitals as we are unable to treat them here. There is no medication and we're seeing an increase in cases of malaria, trachoma, and diarrhea.
Head of the Health Bureau in Housing District, Dr. Asmelash Allana, says despite some support from NGOs and the Regional Health Bureau, the district as a whole is struggling to provide adequate service to patients, especially those with chronic illnesses.
We are in severe lack of medications for chronic disease patients, especially in Magab Health Center as it used to give service to lots of chronic disease patients. But the war and siege-induced lack of medication is still ongoing. There are some medications donated by NGOs such as WHO and the Regional Health Bureau, but it is inadequate to cover all our demands.
The residents in the vicinity called for the federal government to deliver adequate help and medication to save their lives.
Right now, our request to the government is to provide us with medication.
We need medications so that our families and mothers who recently gave birth could get service here in their vicinity.